Hi, Mark. How are
Hi,
you?
Alicia. I'm good. How are you?
Good. Do a
Should we
quick.
pause the recording real quick?
Yes, please. Hi, everyone. Good morning and welcome to today's training. This is a training for the California Department of Public Health Health Ambassador Program on sustainability planning. We are so excited to see so many folks here today. Really excited to have this conversation. Um, we know that you have done incredible work through this Health Ambassador Program. All the time that you've spent building up your staff, reaching out to the community, sharing health education, information, and resources. And we are here today to think about key components, considerations, and decisions to support long-term sustainability of key pieces of those programs. We know, first of all, just want to acknowledge up front that we wanted to have this conversation earlier, and we totally agree, and that feedback has really resonated with us. We want to lean in and provide this now in a way that really helps you look at what you have, the resources available to you, both internally and in the community, um, other funding opportunities, federal, state, local level, really think about how we can continue to uplift the great work that has come out of the Health Ambassador Program. So we're going to cover quite a few things today. Julie, if we go to the next slide. We are going to be thinking about what sustainability planning even is, how you can build partnerships to support program sustainability, really recognizing that this is part of a community process and program. So how do we build on those partnerships? How do we scale up the successful elements of your program? There are things that have come out of this work that we really hope you want to sustain, you want to elevate and leverage. So we want to think through that. Identifying funding to support program sustainability. This is a huge question, a big key when you have one-time funding. So we want to dig into that. And we want to think about how policy change can serve as a way to support sustainability. If anyone wants to share in the chat, please feel free to introduce yourself. And if there's anything you want to get out of today's training, please let us know in the chat as well. And we will take all of that into our presentation. And as Jillian said, that you're at the end of your grant program, some of the principles we shared today can still be relevant for sustaining your health ambassador programs. But we really hope this will be useful for all of your future programs as well. Which, Jillian, quick reminder that I didn't introduce myself, Alicia Lemer, she, her. I work at Homebase. Some of you might have seen me on different pieces of the technical assistance for this grant. And I will quickly hand it over to my colleagues, Jillian and Mark, to introduce themselves as co-presenters as well.
Thanks, Alicia. Hey, y'all. Jillian Marchetti, she, her with Homebase also. You'll hear more from me later.
Hey, everyone. Mark Mora, he, him from Homebase. Excited to be here today with you.
Thank you. And we see people introducing themselves in the chat, saying good morning. Once again, really appreciate y'all here. Please feel free to really utilize that chat to share thoughts, questions. We would love to hear kind of what's working for you, if you have things that you've been running into, there are barriers to sustaining this work. We are here for all of it. And if you would like to come off mute and share your thoughts, or if you have a question, please feel free to use the raise hand function. If you look at your little Zoom control panel, there's a little option to raise your hand and we can call you in. Thank you, everyone. Next slide. All right, so what is sustainability planning? Why are we even here today? Next slide. As we talked about, we know that this program came about from one-time funding, and that one-time funding can be tremendously helpful in starting or expanding a program, or even continuing a program that has run out of other funds. This one-time funding, in a lot of ways, really, we saw it evolve and adapt, but it came out of that urgent need we saw around COVID-19 response, and really reaching this population of people experiencing homelessness with health information, education, and resources. That grew and changed over time, and that has been wonderful, and it's been great to see how your programs adapted to the needs in your communities. We want to talk about sustainability planning because that is part of our thoughtful planning about how to keep those pieces of programs going when one-time funding runs out, so that we don't lose those critical services. We don't have to downsize staff. We don't have to kind of pull all the way back. We can find the pieces that have really worked, keep them going in our communities, and really elevate those. It's also an opportunity to kind of critically analyze and evaluate your program, see what things you do really want to and need to sustain and maintain. Also an area to identify, like, maybe that part didn't work, or, that's not the part that we want to prioritize moving forward. That's okay. You don't have to sustain the entire program. It's elevating those things that worked. And as we were talking about, we want to continue and build upon the impact and outcomes you have seen. You, just by doing this project, you've been doing reporting, you've been tracking your outcomes, you've been kind of seeing what the impact has been for the clients that you serve, as well as the health ambassadors that are employed by the program. That all speaks to the impact and outcomes that you have. We'll talk about later how that can help you do things like secure additional funding, make the pitch to partners to get into this work as well. So really boiling it down, sustainability means what comes next. Many organizations approach sustainability of grant-funded programs with the hope of another round of discretionary funds or private foundation interest. We know that those opportunities aren't always possible, and they don't always have that lasting investment. You can end up getting into the cycle where you're constantly on the bubble of, we have this one year, now we have another year. So sustainability planning is also thinking about, how do we make this something that is truly ongoing, where we're not constantly in a kind of, we're searching for that next opportunity, and if we don't, then everything's gonna break. We're gonna have to pull everything back. Sustainability planning should begin at the start or even before the start of any grant-funded program or activity. And then it keeps going. We keep having those conversations about what is working, what's not, how do we keep it going, how do we sustain this? So way back when you were beginning this, entire journey of creating your projects, I'm sure you were thinking about, what do we do to make sure the staffing is going to be ongoing, that it's sustainable? You were thinking about what services you can provide, and you can provide really well, so that it keeps going, it has the greatest impact. It speaks to your expertise and the ways in which you can align it with your other work. That was already thinking about sustainability planning without even knowing it. So you have either intentionally or probably unintentionally thought about sustainability across the term of this grant. Today is about having that focused conversation about what this means and what this can look like, giving you some tips and advice from other projects and kind of best practices in the field. So this is a really cool graphic that shows some of the different key elements of sustainability as it relates to systems change. So it doesn't have to just sit within your organization. This is about what happens in the entire community to uplift and support the things that have been really successful in this program. So we have building partnerships, having that collaboration so that we can scale and sustain the really great things we saw come out of the work. We have scaling up. That is, once again, taking those things that were really successful, and we're going to expand them. We're going to replicate them, that we're going to elevate them. And part of that is looking at our outcomes, looking really critically at what we've already invested in, and then where we maximize that ongoing investment. Which goes into strategic funding reallocation. We know that we already have existing funding streams and other resources that we're utilizing for other projects, other programs. are there ways in which we can use some of those existing funding sources to help achieve this work? Are there things that we can kind of move around how we are funding our current work? Are there ways that we can tap the existing work we're doing, even components of it, into those existing funding streams because it aligns with that funding stream's goal and mission as well? And then policy change. Sometimes local and state policies can really help us uplift the work we're doing, support sustainability, and it can give it that visibility. So we kind of have this cycle. We have more partners buying in. We have folks who want to scale up the things that are working. We see that the peer support model works. We see that providing health education leads to better outcomes. Now we get more funding, we get more partners involved, and you see it growing at a community level, not just at a program level. So this is kind of the cycle we want to talk about. I think we've hit on this a couple times already, but really want to emphasize that sustainability doesn't necessarily mean continuing a program exactly as it is. If you want to do that and you have the means to do that, absolutely. That is totally, that's something you can do with an eye towards that continuous quality improvement, of course. But it can mean a whole lot of different things. It can mean continuing, as I said, continuing it as is, but it can also mean embedding elements of your Health Ambassador program into other aspects of your organization or your work so that those elements can continue. It could mean partnering so that you're sharing responsibilities of this work. You continue doing the pieces you really can invest in and you're excited about, and a partner takes on other pieces. It can look like continuing to achieve those most important outcomes, regardless of how that is done or who does it. So really taking and looking at a more piece by piece basis of what has worked, and then finding the means to sustain it. And then really wanted to uplift that a key piece of the Health Ambassador model is that we have peers. We have peer employment as part of this program. So people with lived experiences of homelessness have served as health ambassadors through this program since the beginning of your programs. You have been able to see, the impact that has had, having the employment opportunities, having those connections with the community, the benefits not just for peer health ambassadors, but for the community, really making sure that we continue to uplift that. And we know that sustainability planning should include supporting peer health ambassadors in their next steps. That might be continuing on in the same position, could be taking a different position at the same organization, could be taking a similar position at a different organization, could be pursuing new opportunities altogether. That is something for peer health ambassadors to make that decision on their own. But really knowing that they have support from the Peer Health Ambassador program in their next steps. A huge piece of this, and some strategies that can really help think through supporting peer health ambassadors include defining the roles, responsibilities, and successes of their work. Sometimes we just go about doing our day-to-day and we don't realize truly how much we've done. So really working with health ambassadors to make sure that they see the outcomes of their work and that they can talk about that, especially if they are going to a different organization or looking at different opportunities and they are working to kind of bolster their resume, which is another way organizations can help those health ambassadors if they're going on to other opportunities. This one comes right from the health ambassador programs themselves, providing those connections to job centers and employment resources. Some of you are already doing that. You said, we know we can't sustain everyone, so we can't hold on to all of the staff positions, but we are going to make sure that our health ambassadors are supported in finding additional employment resources. And that could also look like identifying partner organizations that may be hiring for similar positions. So all of this kind of speaks to there are some really unique things about the Health Ambassador program. This peer health ambassador piece is one of them. So making sure that we don't lose that as this kind of shift from the one-time funding happens. Great. And I think I hand it over to Jillian.
Yeah, thanks, Alicia. Hi again, everybody. So I'm going to walk through the components that Alicia put up earlier, the sort of thinking about sustainability as systems change, where it was building partnerships and scaling up and funding and policy change. I'm going to go through the first two of those, and I'm going to hand it over to Mark to talk about the other two. So we're going to talk about some tips or some sort of steps to take to build partnerships. I know you all have some strong partnerships, and so just to be clear, we're not assuming that you all do not know how to build partnerships or kind of build relationships with other organizations, but just wanted to, in the context of talking about some strategies to help with sustainability planning, wanted to make sure that we cover this critical piece. So we have in this slide some sort of step-by-steps of building partnerships, and some of these may feel a little bit more obvious than others, but can be really helpful to kind of do some reminding and thinking more specifically about each step. But really wanting to talk through at a pretty detailed level, like what it actually takes when we're thinking about building a partnership. And again, specifically in this context, to think about building partnerships as a way to help sustain either an entire program model or just like elements of a program or the outcomes, as Alicia mentioned, the outcomes that have come of a program that you want to make sure continue on. So we have here 6 steps, and we'll go over a couple of details about each of these, but just to kind of set the context. The first few are the kind of setting things up. So like identifying who your potential partners might be, learning about each of those partners, and also kind of thinking about your own programs or you as an individual, like your own strengths and needs, and kind of how those mesh together. Once you kind of have a concept of which potential partners you might have, thinking about how to actually like build inroads, how to kind of get started with relationship building. And then we'll talk about how to kind of identify and highlight like what the value of each partnership could be, and how to sort of develop goals or thinking about, developing goals and kind of clear roles to kind of move that partnership forward. So for the first few steps, we're kind of categorizing these as like doing the research or kind of getting ready or sort of thinking through potential partnerships. So that's step 1 of identifying folks who could be good potential partners, programs especially. So thinking things like what are the organizations that serve either the same or like an overlapping population to the folks that you serve, who has similar goals, like a similar mission and vision, which organizations are focusing on similar issues, or again, like kind of overlapping issues. Or other ways to think about it are what organizations or individuals are affected by or kind of interact with the population you serve, and similarly who has the potential to affect or impact populations you serve. So obviously thinking about like if you're a nonprofit, other nonprofits that kind of serve similar folks or have a similar mission or vision. If you're thinking about who's either impacts or is impacted by folks that you serve, that could be broadening it even more to like, for example, thinking about other service providers, other types of public services, maybe even like local businesses. So just wanted to give a couple examples, but kind of thinking through those questions can be useful in terms of identifying like who could be a potential partner to your organization. When you have either one or more potential organizations that you've thought of that could be good partners to you, thinking about really trying to learn as much as possible about that potential partner can set you up really well for actually building relationships, right? So thinking about and identifying like what are their main goals, what incentivizes them to do their work, what are the biggest needs that they have, and some of these things you can do with research or talking to other organizations, and some of these might just come from like initial conversations with the organization or someone that works with them, right? But in addition to kind of thinking about what their biggest needs are and their goals, really identifying like what are the challenges that they're facing, what are their biggest limitations in order to accomplish the goals they have. So once you kind of have a sense of like who your potential partners might be, what their strengths and their goals and their needs are, then kind of thinking about your own program's strengths and needs and kind of how those match well with your potential partners. So what can you offer to a potential partner that will help them overcome their challenges, address the needs that they have, help them achieve their goals, and vice versa, right? So what needs or goals of yours that you're not internally able to fully realize might a potential partner contribute to, right? Like actually like outlining what those things are can really help in terms of setting the stage for really building a strong relationship. So when you have that, right, step 4, looking at actually figuring out potential inroads or kind of the initial steps you can take to start to build a relationship that leads to a partnership, right? So things like existing meetings that you maybe could join, either just that organization holds or that they attend. So as an example, if it's a program that operates within the continuum of care in your community, if you don't already attend those meetings, starting to attend any open meetings or like work group meetings or things like that can be ways to help identify any like existing working relationships that maybe some of your staff have with some staff from that organization. So for example, your health ambassadors likely interacted with other folks who are doing other kinds of outreach, or other folks, other organizations that were working with the same clients that you all were. And so there might be some existing, even newer or kind of unofficial relationships just among staff that you can kind of help to sort of get your foot in the door and thinking about building that relationship. And thinking about funders and funding opportunities, a couple of things there. There could be, if there's a funder that you either have already or think funds work that's relevant to what you do, kind of taking a look at, sometimes funders have on their websites, for example, like organizations that they provide funding to. So if you find an organization there, that funder might be, whether it's an existing fund of yours or not, might be helpful to like introduce you to another organization that they fund. Or if there is a funding opportunity that you would like to go for, that can be a really good opportunity to like approach a potential partner and say, we were thinking about going for this funding opportunity. Would you be interested in talking about like partnering to go for it, for example? And then if you're, when you're kind of further along the line and you've started thinking about ways to kind of approach or create those inroads with potential partners, these last few steps that we're going to go over are really kind of looking specifically and really like identifying clearly what the potential value can be, right, of a partnership between you and another organization or individual, right? So like that kind of matching up what your strengths are and their needs and vice versa, really thinking through like what potential impacts or outcomes that you could have, that you could measure if you have a partnership with them, and really being specific, like how the partnership will benefit both you and the other organization. Really, obviously, like very significantly, how it will benefit the people that you each serve, and the community as a whole can be really helpful ways to really like sketch out and really highlight and make clear what the value of a potential partnership would be. And then finally, developing clear goals and figuring out like kind of what the different roles are in a partnership, right? Like what each partner organization will contribute and how you're going to measure whether your partnership is successful at what you had hoped it would achieve. And also that can include kind of thinking through together what other partners might, bring something specific to the table that's still needed, even with what you're able to achieve with your partnership. So that's the sort of last bit for the actual like step-by-step. We just have a few kind of tips here for maintaining and growing partnerships. And I do just want to pause for 1 second here. I think Alicia said this earlier, but if just wanted to remind you all, we're covering a lot in this hour. So if you have questions, please feel free to put them in the chat at any point, and we can pause and answer them if we need to, and we'll have some time at the end too. So thinking about maintaining and actually growing partnerships, we just have some really, these seem very basic, but just really important things to keep in mind when you're trying to maintain and grow a partnership that you have. So communication is obviously really important from the start, really consistent communication, figuring out how you're going to kind of keep in touch with each other about how things are going. Keeping things as simple as possible and starting small, but kind of keeping a bigger picture in mind can be really helpful in terms of, especially if it's a new partnership that you're kind of working on. Really taking advantage of each other's strengths and resources and tools, and being able to share data and information and resources as much as possible. Collaborating. I mentioned the potential to collaborate on funding opportunities. That could be a really big one. And then also just like kind of thinking practically that, especially again, if it's a new partnership or a new thing you're trying out, to just be expecting that there will be growing pains, there'll be some challenges, right? And again, that's where that consistent communication is really important, to kind of keep in touch about what's going well, what's not going as well, and if there are kind of adjustments you can make as you go. And really being willing to compromise is obviously really important, because as much of a great match as you find with a potential partner, there'll always be some room to kind of meet each other in the middle somehow. And as with anything, right, kind of keeping in mind or keeping an eye on how things are going, assessing how things are going, making adjustments as needed as you sort of go along in building a relationship. We have sort of several potential partners for peer health ambassador programs or similar programs. These are kind of, don't want to suggest these are the only potential partners that you could think about, but these are some kind of key partners. I know you all as organizations, even before this program, probably had some relationships with or aware of some of these categories of potential partners, but wanted to just lay them out. We have some kind of more like health system side partners, like hospitals and community health centers, mental health providers, for example, all folks that could be really good partners, especially thinking about how your like clients and missions overlap. And then also, of course, some organizations that are a little bit more on like the homeless response system side of things. So outreach teams of different kinds, street medicine programs, shelters, other, COC and other providers as well. So that's it for the building partnership pieces. I don't see questions in the chat, but I'll pause for just 1 second, just in case anyone does have any questions on anything we've covered so far. Okay, so I'm going to move us into thinking about one of those other key components, again, from that circle graphic that Alicia shared earlier, of thinking about how you can scale up successful elements of your program. So when we're talking about scaling up, it usually means, expanding or replicating a program so that you can reach larger populations, right? So you can have a bigger impact. And it usually involves like implementing a program at an additional location or expanding a current location at an existing site, for example. So that's kind of like, I think, what the most common thinking is when you're talking about scaling up. We're going to scale up this program, we're going to make it bigger, we're going to go to additional sites, we're going to like broaden the impact. And the primary goal, the reason for that is because the primary goal is really to increase the impact of a successful program, right? But the reason we're talking about it in the context of sustainability planning particularly is because often if you're able to increase the impact, sometimes this could be scaling up with, at other partner locations as opposed to just your organization making the program bigger, right? So kind of overlaps with the partnership piece. It also can be a way to, if you're able to expand a program or an element of it, or increase the impact without having to kind of start a new program completely over. It can be a way to kind of get additional funding, for example. There can be ways for you to sustain a program by scaling it up. So that's why we're talking about it in the context of sustainability planning specifically. And I just want to note that although this concept of scaling up feels like it might be bigger than what is relevant for maybe this conversation and health ambassador program specifically, the principles that I'm going to go through in these next handful of slides can really be applied to not just like scaling up in the common sense, but also just thinking about like, as Alicia mentioned, identifying and maybe replicating or continuing like individual pieces of a program or like particular components or elements that are working well that you want to continue. So again, even though the language of this will feel maybe very big, the principles can really be applied at a smaller level. So again, kind of just some benefits or kind of from potential good outcomes of scaling up. The idea is it's reducing the need to kind of start from scratch, right? So you're saving time and resources, and kind of enabling, again, bigger impact with a smaller sort of upfront cost because you're building from something that exists, right? So it allows for sharing of resources and like procedures, for example, throughout. If you're going to you're going to expand to additional sites, you're not having to start over at each site, right? Because you have a lot of things you've learned, you have institutional knowledge, you have policies you can share, resources you can share. And so you're able to really produce a much, a bigger outcome at a quicker pace and with less like upfront investment because again, you're not starting from scratch, you're sort of building from what you have already. And it can also result in greater visibility of a program's impact, right? As the impact grows and, if for example, if sites grow or your program gets bigger, that visibility increases, which can, of course, lead to opportunities for additional funding or additional partners, things like that. So some kind of key considerations to discuss, and then we'll go through a sort of step-by-step similar to we did for the partnership building. Thinking about like whether if you're talking about expansion or replication, where's there room in your existing program to expand either to like additional clients, for example, or additional or just additional locations like from the same program. Replication would be if you want particular aspects of a program to be sort of repeated or replicated elsewhere, or just the entire program, replicated at an additional site, for example. Thinking about how to kind of think about how you might incorporate the program or even just, again, components of the program into other areas, either of your own organization or agency, or into other agencies or departments or even communities who serve the same clients. And then that last piece that's really important is kind of thinking about what are the most important outcomes that your program is achieving, and what are some additional or different ways that either you as an organization or even your partners can kind of continue to see those outcomes, even if you need to sort of change some things around or not continue a program wholesale. So again, we're gonna walk through this concept of scaling up kind of step by step. And I do wanna, I'm not repeating myself a bit, but really just want to emphasize that, again, some of this language sounds really big, and it can be, right, if that's what you're doing in terms of scaling up, but these can all apply to kind of thinking through just continuing or expanding or replicating like components of a program. So hopefully these principles will resonate with you, even if you're not thinking of like expanding your entire health ambassador program or other programs. So thinking about kind of thinking if like the program is kind of ready to be scaled up, determining what the best approach is to trying to scale it up, working through the actual logistics to kind of prepare for doing so. And that includes kind of making sure you have the right infrastructure and capacity to do so, you or, you know, or a partner, for example, and then kind of thinking about evaluating how it's going as you do it. So similarly, we'll kind of walk through some step-by-step. So if we're thinking about like ascertaining the readiness of a certain program to scale, there's like a few things to consider. Ideally, the program will have like an outcomes-based model, right? That really links like what you are doing in the program and links that to positive outcomes that you're seeing, outputs that you're seeing. And in looking at that or thinking about that, you should kind of be able to be clear about which components are really essential to seeing those outcomes and which things there might be flexibility, right? So like, again, you don't have to scale by completely replicating a program exactly as it is. If you kind of are able to look a little deeper and think about like, what are the really critical elements of this that are helping us see these outcomes? Like we hired folks with lived experience, and that's how we were able to see better outcomes with like working with folks who are currently experiencing homelessness, for example. Like if that's like one of the critical components, that's great to know. And there might be some other elements of a program that like are less directly tied to your positive outcomes that you might be able to kind of shift and change as you're thinking about what to continue or what to scale up. Second, you're thinking about how your program, how the implementation of the outcomes, like whether the program was actually implemented as you originally proposed it, whether it was effective, and if so, what made it effective. Some of this is kind of overlapping with what I just shared. How there are certain elements that kind of led to your success or your positive outcomes, how they might be able to be transferred to either other communities or settings or other programs that you run, and whether the program's impact was like large enough or positive enough that it's can be replicable in other circumstances. And then finally, you want to make sure that your the idea of scaling the program has buy-in from stakeholders, right? Including potentially funders, right? Because you'll need some support in order to think through like how to replicate either individual components or the program as a whole. And looking at like evaluation results can be really critical, right? Because if you can point to the value that your program added, that can really help with securing buy-in. Sorry, I think I said finally before, but what I misspoke. So this is the last bullet in that. Step one is thinking about making sure that the organization that like your organization, right? If you're thinking, especially if you're thinking about scaling up an entire program, really like making sure you're solid from an organizational and financial standpoint and can kind of withhold or like hold that as you're trying to make it work. Step two, thinking about how do you determine the best scaling approach, right? Whether you're fully replicating a program or expanding it, if you're just kind of thinking about replicating or continuing a specific concept or idea or like a component or element, there's not really one like right process for scaling. So any kind of possible approach could be considered when you're trying to figure out what's the right way to move forward. The most sort of straightforward, but certainly not the easiest, is kind of just full scale replication, right? This program is working great, everything is critical, let's just do it again somewhere else or expand it, right, bigger. But there's some other kind of smaller, like more nuanced approaches, right, that we've talked about a little bit. So things like, again, kind of focusing on replicating a program's impact rather than like the full program, or just focusing on like actually replicating like specific components or elements of it that really are what make it work well. So kind of once you're sort of figured out like what it is you're actually trying to replicate or scale or continue, right? Actually working through the logistics that are needed. So again, kind of making sure you're firm on which elements of the program are the most necessary for success, considering what capacity either your existing or potentially new staff have, or your programs have, or other agencies might have to support those elements. And again, like if it's not your agency that's kind of trying to replicate within itself or continue things, considering what other agencies might be interested, might benefit from, you know, replicating the programs, the program that you've made work well, or even the components of it. And again, that last bullet is, of course, overlaps a lot with the partnership piece that we talked about. And then step 4, making sure you have the right infrastructure in place. So again, this kind of management infrastructure and the evaluation process especially are, I think, especially critical if you are doing a true scaling up, right? A true replication of an entire program at other sites. But again, even if you're just thinking about replicating or continuing particular components or impacts, thinking about like what structures you might need, if any, that you don't already have in your agency to make sure that things kind of continue as is. If you're going to be sort of transferring certain components from your health ambassador program to like some other program your agency operates, for example, like making sure that you have leadership on board with this, and the service staff that you're kind of transferring duties to are kind of aware of what the needs are, and they're kind of trained up well, and educating leaders of like whatever necessary resources are required to make it work well. And then finally, again, as with everything, you want to kind of keep an eye on how things are going, focusing on whether the kind of new iteration or the expanded iteration of your program, how you know it's working well, making adjustments as needed, and really making sure you're kind of evaluating how things are going to keep improving as you go. So that was, I feel like that was another mouthful. So I'll just pause 1 sec before I hand it over to Mark to move on to the next section. So I don't see questions in the chat. Appreciate, Nelia, your comment about liking the scaling up to expand the capacity approach. If anyone else has comments or questions, feel free to put them in the chat, or again, raise your hand. Not seeing any, so Mark, I'll go ahead and hand it over to you for this next bit.
Thanks, Jillian. Hi again, everybody. Mark Mora with Homebase. I'm going to be covering the remaining sections of the presentation. You just heard about how to scale up elements of your program. I'm going to talk in this section about how to identify funding to support program sustainability. Next slide, please. So again, these are probably questions you all have really good answers for already. So it's not to say that you don't know this or you're not doing this work, but sometimes it's a good reminder to kind of think about your program that you're currently running. Could be the Health Ambassador program, or even a program that you are thinking about building and getting funded. So this slide just talks about how important it is to identify the core characteristics of your program before you go search for funding, or at least it could be helpful and make the process a lot more efficient if you have these things in place. So again, if you haven't done so already, it can be incredibly helpful to write these answers down to these questions, particularly what makes your program unique and valuable. So I'm just going to go really quickly through these questions. For instance, who do you serve? Do you serve an entire population in a geographic area? Do you serve certain subpopulations, for instance, youth, veterans, maybe unsheltered people? Do you serve people who meet specific program criteria? Also, this question kind of leads to deeper questions about why your program is choosing to serve a particular population, what needs are being addressed. Another question is, where do you provide services? Do you provide services in particular neighborhoods, in one city, multiple cities, maybe multiple counties? Are you co-located strategically in a health center or a school to have access to particular populations? Another question is, what are the services you provide? So that one's pretty straightforward. Do you provide street medicine, case management? Maybe you do policy advocacy. Maybe you develop leaders. Maybe you do a combination of things. What's unique about your program or your staff? So this is a really important one because this is how you can really set yourself apart from other potential programs to fund. So is it the first program of its kind in your area that you're intending to operate? Is it the only one? what does your agency or your program do particularly well? Maybe your staff has a significant amount of lived experience or expertise of homelessness or substance use or time in the criminal justice system. So you bring a unique perspective and amount of credibility to the work. Maybe you have a unique approach to outreach and engagement, or a set of non-traditional partners that you've recruited to the fold. Whatever the case may be, funders want to see how your program is going to bring about different or deeper outcomes versus other programs they can potentially fund. Another question is, what are your outcomes? What impact is your program making? This is the value add to the community, the reason or reasons why a funder is offering money in the first place. Maybe your program outcomes are to increase the rate of COVID testing or vaccinations among a certain population. Maybe you want to lower rates of substance use or increase access to healthy foods or reduce the recidivism rate. Maybe you have multiple outcomes. The key is that your program outcomes are addressing a real need in your community and that your program is designed in a way that's going to bring about those outcomes. And then the last few questions on the slide are just about the role that your program plays in the community and what would happen to the community or people if you serve, if you have to stop providing services. Again, this is kind of emphasizing how vital it is for your program to exist and to get funding because it meets a particular community need. And then last thing I'll just say, I mentioned it earlier, but maybe you know these things, but perhaps you haven't written them down. It's really, really important to write these things down. Can not only help you in terms of identifying and narrowing down which funding sources you should go after, but also cut down time when you're actually writing proposals. Next slide, please. So once you've written down and identified your core characteristics, that's going to help you a lot for searching or narrowing your search for funding opportunities. In the case of the Health Ambassador Program, for instance, you could look, if you're still looking to sustain the program or elements of the program, you could look for funding opportunities according to the particular program areas or aspects. So for instance, you could look for funding around harm reduction or street outreach or community health education or the peer support model. This is helpful. This approach is also helpful because it's not always possible to find one large funding source to cover every aspect of a program. And I'll talk a little later about why sometimes that's not necessarily a good thing. You may need to secure multiple funding sources to fund different aspects of the program. Another approach is looking at funding opportunities according to the potential populations of focus. So you see some examples there: youth, veterans, families, historically overrepresented and underserved populations, for instance, LGBTQ folks, BIPOC folks, Latinx community. And this approach is more prominent with corporate or philanthropic sources, funding sources, where funders are looking to focus on a certain population according to the values of a benefactor or a company. Next slide, please. So once you've identified, again, your core characteristics and kind of thinking about your approach, then you want to look at particular types of funders. And if you want to, in the chat, if you see any categories of funding sources that are missing here, please type it into the chat, or if you want to, you can unmute or raise your hand. But I'll go through these real quick. So there's government funding, federal, state, local, and there's some examples there. Just reading out a couple: ESG's Emergency Solutions Grant. Sometimes local departments of public health have funding opportunities that might be appealing for your agencies because they fund particular program areas. Health system providers, so managed care plans, hospitals, health insurers often have funding opportunities to fund different programs and outcomes. Institutions of academics and research, so maybe your local community college or your local California State University has funding opportunities or can partner with you in different ways around research projects There's also philanthropic dollars through community or private foundations. There's also less traditional funding sources. So corporate giving, social responsibility funding, sometimes faith-based organizations align with some program outcomes that you're looking at. I also want to know, it's not mentioned here, but in-kind support is also something that can be really important towards sustainability. In-kind support means non-monetary support, so things like volunteers, maybe an agency is willing to have you co-locate in one of their buildings for free or for low cost. Maybe through a university, nearby university, you can have access to trainers or training materials, or help with an evaluation for a program. So all of those things can be considered in-kind support. Just going to pause there really quick, see if there's anything in the chat. Okay. Not seeing anything. But again, feel free to pop in any questions in the chat or raise your hand, or again, put anything down that you think is missing in terms of potential funding sources. All right, next slide, please. So these are just some tips on how to determine whether funding is compatible with your program, right? You don't want to waste time putting together a proposal or going through the ask if the goals or the mission of that funder don't align with your program. And so some tips are to review their mission, their goals, explore past funding opportunities in addition to current upcoming ones. Oftentimes funders will put out a list of organizations or programs they funded before, or there are ways you can go look for that. For instance, if you're in the nonprofit sector, you might be familiar with a philanthropic site called GuideStar. There's other sites like it, but it helps to connect you to information about funders or people looking to get funded. And there's something called the 990, which is a tax form that nonprofit organizations complete with the IRS. And you can look at organizations' 990s through a site like GuideStar. You can have access to a list of organizations that they funded in the past. That can be really, really helpful for you to see if maybe your organization would fit kind of what they're looking for. You can also do a reverse search where maybe you know of agencies like yours in your area or in other parts of the state or the country. You can go look on their websites, and oftentimes they have a funding page, and you can figure out what organizations fund them, and maybe that can be a way you can get connected to some potential funders. So yeah, I just want to maybe read one more here, but definitely understanding the administrative and reporting requirements for available funding opportunities, i.e., not every available funding source is necessarily a good and worthwhile funding source to go after, particularly when there's a lot of restrictions and if it doesn't meet the true cost of what it takes to run your program. So again, we talked about potentially finding multiple funding sources, but just be really careful, be wary that, you know, part of sustainability is identifying what it really costs to run a program, thinking about what realistically your agency overhead is, how much does it take to pay your staff, including any people with lived experience, a living wage and or market rate, right? And being realistic about whether that funding opportunity really sets your agency up for success. It's okay to say no if it leaves your agency or at a significant loss, or it's, you know, it sets up unrealistic expectations or outcomes. And, you know, it's also okay to go after funding and know that it's not enough to cover your needs, but you have a plan to try to cover the overhead gap, perhaps through another means. So yeah, just really think about this compatibility, not just does what their outcomes align with your outcomes, but again, is the funding itself enough to sustain my organization and the program design that I intend to run in order to meet those outcomes. Next slide, please. So kind of talked about this already, but just that first bullet, it's try not to put all your eggs in one basket. Or if that's the case, maybe you already did, and that's totally fine. And maybe you have you know, a certain number of years with this funding opportunity. And you can use that time to build a plan about how you're going to diversify the funding sources and or sustain the program long term. Key tip, it's never too early to start the process. So yeah, really start, you know, if you haven't, start thinking about, you know, really from program conception, how are we going to sustain this program, and what kind of plan can we build? Another bullet here is just being open to internal reallocation. So this one is just thinking about if there are any funds you already have in your organization that you can reallocate towards this program. And sometimes it's because there's like similar programs that are running an organization. Maybe things can be consolidated. But also note that, you know, oftentimes grant funding specifically is very restrictive. And so you really have to look at a funding source and maybe and even check with them if you have plans to kind of move some funds around or move some programs around. It can be easier to look at unrestricted or less restricted funds like individual donor dollars or foundation funding, or some foundation funding can be unrestricted. So yeah, I think because of time, I'm going to try to move us forward. Next slide, please. Yeah, I think just some additional tips here. So using data to tell your story, particularly if the program's already been running and you have some success, really leverage that data and those stories, so you can get more funding. And then if you can always be helpful to invest in a grant writer. But again, just think about ROI, return on investment, in terms of the funding opportunity that you're asking someone to write for. Is it, do you have a good chance of getting that funding? And once you get that funding, is the payoff worth it? Next slide, please. And last bit for me is just kind of thinking about how policy change can be a way to support sustainability. Next slide. So this one is not as applicable to a health ambassador program because the work was not really inherently about policy change, but again, it's helpful to think about sustainability also in the lens of policy, because if programs exist to bring about community change, one of the ways to make that community change sustainable is to look at trying to pass policies, and policy can be multiple levels, can be at an organization level, can be a COC, continuum of care level, could be at the state or federal level. But just thinking about the work that you're doing and how you might be able to scale some of that up to impact policy. And again, if your agency doesn't work in the arena of policy, that's fine too, but your agencies can also support other organizations that are doing explicit policy work. But just thinking about, what kind of partners or potential partners you might need to help you advocate or work for needed policy change. And another way to kind of think about this is, policy changes can often be kind of population or larger scale level impacts versus more individual level. So, some examples are, an organization might be helping people quit smoking versus, policy that maybe prohibits the sale of certain tobacco products that target marginalized communities. Like that can have a really larger impact on the population, or like, healthy eating education, more individually focused versus maybe protecting or increasing access to CalFresh benefits is more population level. But again, all of that work is important. Just thinking about how some of the changes that you want to make in the community can be more sustainable and long-term. So next slide, I think we are near the end. We have a few minutes. Do you have any questions on the section I just covered, or anything that Jillian or Alicia covered earlier? We realize that this is a lot of information that you could spend a boot camp or weeks covering, and we try to do it in 1 hour. So hopefully you found at least some bits useful.
Hi, this is James from Healthy House. I have a question.
Go for it, James.
Yes, earlier you mentioned a resource that we could use called GuideStar. Are there other sites like that we could use too?
Yeah, GuideStar is really helpful. I don't know if any off the top of my head. I know that there are other sites that exist. I don't know if Julian or Alicia know any, but it's something we can also look into for you and follow up with an email with some resources.
Awesome. Thank you.
Thanks, James. Any other questions before we wrap up? All right, we'll hang out for maybe another minute or two in case people want to stick around and ask some questions. But just want to thank everybody so much for being here and taking part in the training series. Once you close the Zoom window, you're going to get a pop-up. A browser is going to open a post-training survey. So we would really appreciate if you can complete that survey. It would help us to improve trainings moving forward. And we will also follow up via email with materials from this training as well as the other two trainings that happened this week. All right, well, again, we'll hang out for another minute, but folks need to hop off. Thank you so much for being here.
Okay, I will be out there from 1 o'clock to tomorrow.